Emphysematous cholecystitis is another complication that can arise from acute cholecystitis. So the way that I like to remember what emphysematous cholecystitis is I think of emphysema, and emphysema is a lung condition that causes people a hard time to breathe or get air in. And emphysematous cholecystitis is actually the accumulation of air within the gallbladder. So those two kind of go together, helps me remember that it has to do with air. Emphysematous cholecystitis is a pretty rare condition that follows acute cholecystitis, and it happens because bacteria within the gallbladder produce air. It is more likely to be seen again in elderly men, probably due to the fact that they are not seeking care soon enough in the setting of acute cholecystitis, so that it gives it time to progress to the emphysematous cholecystitis. And we actually also see it in diabetic patients. There are typically gallstones present in emphysematous cholecystitis, but it's not always the case. If you see emphysematous cholecystitis on your patient, we need to make sure that we are documenting it appropriately and then getting that information to the correct providers, because this is a surgical emergency. It can be fatal if this is left untreated. So let's take a look at what emphysematous cholecystitis looks like on ultrasound. As the name mentions, emphysematous cholecystitis means that there's an induction of air within the lumen of the gallbladder. So what we typically see is a bright echogenic line at the anterior portion of the gallbladder, and that bright echogenic line represents air. Behind it then, we will see a ring down artifact that is typically seen behind gas bubbles. In this picture here, again, we have bright echogenic foci. This is seeing those air bubbles, that bright spot, and then we see the ring down artifact behind it. When we see bubbles with the ring down artifact behind it, we call that the champagne sign. You can kind of see from this picture here, as the champagne bubbles rise to the top, they create kind of a brighter layering effect with some light refracting behind it. So that is that comet tail that we see behind the bubbles in emphysematous cholecystitis. And this picture again shows us another example of air within the gallbladder lumen and then ring down artifact behind it. So remember that emphysematous cholecystitis has to do with air accumulating within the lumen of the gallbladder due to bacteria. On ultrasound, we'll see a bright echogenic line with comet tail artifact or ring down artifact posterior to it.